And this just in, the governor of Lagos, Babajide Sanwo-Olu, is giving an update on the coronavirus situation in the state.
Vaccination.gov.ng. You can find the list of health centers facility online at the various vaccinations, and you can take. You can also check the Lagos State website. You will know where all the 150 centers are. Obviously, our ultimate goal, is to have an herd vaccination immunity, meaning that at some point we're planning to have almost 60%, of our population vaccinated. Let me also further re-emphasize that vaccination is free, in all of our locations. If you have gotten your appointment and you come around, they are meant to be given to you free of charge. But it's important for me to reiterate that the Moderna vaccination is also a double dose vaccination like the first one, which was the AstraZeneca. And what it means is that when you receive your first dose of the Moderna, you'll be given a date when you need to return for the second and the final dose. It's important to say that the Moderna that we're administering from this week should not be mixed up with the AstraZeneca, meaning that if you have taken the first dose of AstraZeneca and you're waiting for your second dose, please don't rush to want to say you want to take the Moderna. Just wait, because we're expecting, another shipment of the AstraZeneca, so that people that have taken the first dose, they can now go and take their second dose. So please do not mix up, the ones that we're giving now to the first dosage that we have taken with the AstraZeneca. So we just plead that people should exercise a bit more patience. Once we have the AstraZeneca, the people that have taken the first dose will be the priority for them to take their second dose and be fully vaccinated. Under and around the travel protocols for inbound passengers, I think it's important for us to reiterate again that we're tracking persons of interest, as they arrive into our state. To date, so when I say to date, from May 8th, 2021, when we started tracking, the POIs, till yesterday, we've had almost 90,000 persons of interest that have arrived at the Murtala Mohammed airport. Of this number, a little under 1,100 of them tested positive. So it's an exercise that we're doing, and we're ensuring that we do not have anybody, missing out of the tracking. But as indicated by the Presidential Steering Committee, persons that are coming from the red zone countries, which is still India, South Africa, Brazil, and Turkey, are expected to have the mandatory isolation. Mandatory isolation meaning that you have to go to an identified, hotel, and you need to isolate, for the first 7 days. To date, as at 21st yesterday, Lagos had identified over 5,998 persons, and we have successfully isolated about 4,500 of them from the red listed countries, meaning that sadly about 1,000 people have also absconded, for one reason or the other, and so the COVID-19 protocols on mandatory isolation puts in place by the PTF. We're encouraging Nigerians to please still present themselves, for this mandatory isolation. If you disregard this protocol and you abscond, you're putting the rest of the country, on a very big risk, and want to plead that people should not do that, because it's not a decent thing. And you might not feel the symptoms now, but when you get home, if you are coming from those red, you can indeed infect, your loved ones and members, of the community. Regarding testing and treatment, and for us to be able to better manage the pandemic, I'm sure you know that we have invested heavily on our Lagos Biobank, and we're the only ones, apart from the federal government agency, that have the sequencing, capability now. So we can actually have a sequencing even after the positive, cases, so that you know what strain of the virus you have, and that is really helping us, and it provides us with information on how to better manage the pandemic. Worldwide there are different variants. The Delta variant happens to be the most prominent right now. And so we have the sequencing capability to be able to determine that indeed, if it was under the Delta variant, of the COVID-19 that you have. And so in terms of treatment of the more severe cases, let me say that a few things specifically are being done, which is regarding the use of oxygen. I'm sure you know that oxygen is a vital requirement for the management of the most severe cases that we've seen. We have indeed seen a gradual increase in the uptake of oxygen during this pandemic, from a utilization of about 75 bottles per day at the beginning of this third wave, which was about 3 weeks ago. Now we're seeing about 400 cylinders of oxygen being used per day. With the modeling we're seeing and we're currently conducting, we believe that there might be a further increase in the uptake and the use of oxygen over the next few weeks. So we're exploring several ways of increasing our oxygen capacity, which includes our partnering with some of the private sector providers. I'm sure you know that we currently have 2 oxygen plants right now, and we're expecting to complete another one at LASUT, which is the Lagos University Teaching Hospital in Ikeja. And we're also expecting delivery, of additional 2, one from the state government and one from the federal government, which we believe will increase our oxygen capacity. We're hoping that at some point in the course of the state, we should be able to generate close to 1,000 cylinders per day in Lagos State. I think it is also important for us to note that oxygen supply is free at all of our public designated treatment centers in Lagos. We encourage members of public to report, anybody that is asking anybody to pay any sum of money before they're given oxygen in any of our isolation. And this, they can report or escalate to my office or to the Honorable Commissioner for Health to ensure that appropriate sanctions are given out. Oxygens are free in all of our public isolation centers that we have under our own care to the general public. Just to generally just conclude and to say that it's been a lot of challenge for us managing this nature and this scale of pandemic. Certainly it's not an easy one for us. It's very expensive and it requires a lot of hard work, commitment from a wide range of stakeholders and partners who are sacrificing their time, their energy, their resource, and multiple fronts to slow down this virus. And eventually, we're believing that we will tame it again. It also involves the direction of maintaining a livelihood and ensuring that the disruption of our social economic activity is minimized. So we'll be very careful not to be very draconian with pronouncement. We're believing that with you gentlemen of the press, reporting this thing on a daily basis, it will strengthen the response from the general public to know that it's still very much with us, and it's only when we all take, the individual personal responsibility that we can slow down this third wave and we can bring it, under a permanent, reduction. As always, I want to thank members of the Emergency Operations Center and our incident command systems at our various isolation centers. I also want to commend our health workers in the public and private sector. Special thanks also go to our colleagues in the federal government, federal institutions, who have continued to also show high level of dedication and commitment at the management of this response. We're grateful to all Lagosians out there who have accepted a personal responsibility that lies upon each and every one of us, and they are playing their own role at ensuring that we can tackle this virus. To everyone else, I appeal for us for your cooperation. I think it's important. The threat of coronavirus is not theoretical. It's not just a book thing. It's with us. We can see it, and it is real. We have been on the journey for about 18 months now, and we have all witnesses to the immense disruption that this has given to each and every one of us on all fronts. Not to talk of the unfortunate number of lives that it has had to take away. But we believe that we're united in our desire to put this virus and the pandemic behind us as quickly as we can. But this will not happen. This will only happen if we continue to ensure that all of us work together. We do not disregard the health protocols that have been issued. We cannot afford to allow any sense of fatigue to set in. The consequences, I'm sure we all know, is enormous. Let's continue to avoid large gathering as much as possible. Large gathering as much as possible, please. You know, in all of our centers, we keep saying that it should not be more than 50%. Our religious houses and also, it's still very, very important. The variant that is out there now is a lot, more infectious, and it can catch, people a lot stronger. And please, let's just take this very, very seriously. And please wear your face mask at public places. Please wear your face mask and maintain high level of personal hygiene at all times. Like you keep saying, if you show symptoms, that you might have contacted the virus or you have been, in contact with somebody that has contacted the virus, please contact our telemed center, Eco Telemed on the hotline, or please get tested. You can walk into any of our public, testing facility and please get tested once you think that you've been exposed or you've been in contact with somebody that that the person have turned positive. We believe that we can make this third wave our final one. I dare say that in some countries they are actually even talking about the fourth wave. We can actually make this third wave our final one, but we cannot do it by ourselves alone. We need all of us to understand and to appreciate that, as tough as this thing are, we're not backing down, we're not stopping, we're not even reducing, our intensity to ensure that our frontline health workers have everything they require to work and all the resources that we need to put on the table to fight this third wave. We're doing everything within our capacity. I want to thank you very much for listening, and we're now open to a few questions and clarifications if there are any. Thank you.
Thank you very much, Mr. Governor.
Thank you.
Questions, gentlemen of the press?
Good afternoon, sir. My name is Ade Doja. I work with TVC News. No doubt that the intense ferocity of the COVID-19 pandemic has reduced globally, talking about with the vaccination. But recently, we've also seen that fully vaccinated people are not just contracting the virus. Some reportedly died of the virus. If you see such people, if you see the people that are yet to be vaccinated, what will you be telling them? Because some of them have lost confidence in the vaccination and they've started questioning people, why should they need to get vaccinated? That is my first question. So what is the state government doing in terms of increased sensitization and of course to bring back the confidence level of this set of people, the unvaccinated people? Then my second question is the COVID-19 that we know that started from Wuhan was the wild type. And it came with the symptoms of cough and sneezing and all of that. But these new variants, people said it attacked the lungs straight away. So I would like to know the characteristics of the Delta variant itself. Thank you, sir.
Good afternoon, Mr. Governor. All that courtesy is duly extended. Good news to hear that the vaccination or the commencement of Moderna vaccination is on Wednesday, the 25th. But, sir, in the last exercise, the first phase of vaccination, it was recorded that towards the tail end, people were actually waiting for the second dose, had difficulty. They were getting to centers that they were being told that the vaccination had been stopped days before the announced date of stoppage. And then in some cases, some citizens, privileged citizens, so to speak, had people come to their homes to vaccinate them, leaving others who had cards and had appointment dates left unattended to till as we speak at the moment. What's the Lagos State government going to do about this trend? Thank you, sir.
Good afternoon, sir. A couple of while ago, my name is Maureen Ogolo. I report for Nigerian Info, Wazobia FM and Cool FM, sir.
You work for?
Wazobia FM, Cool FM, and Nigerian FM, sir. So a couple of days ago, someone called our station and said she went to one of the hospitals and she was asked to pay 1 million naira.
She went to
one of the centers, the public health centers for public health centers.
Can you be specific? Would you know where?
No, she didn't mention.
Okay.
But she said she
called your station.
Yes, sir. She said she was asked to pay 1 million naira for bed space.
You know, you should have gone further and just asked.
She was distressed, crying, and saying her husband was presently in the state of a very critical condition, and she had nowhere to go. So at that point, all we could get, the information we could get from her was, hold on, we'll get in touch with somebody from the Ministry of Health to speak.
And so what did you do?
We were still waiting on the commissioner to respond to us. We called, but there was no response.
So even for you,
I wasn't even in the office then.
Okay. Well, because this will be an isolated case, because if indeed you also have those information, we could have actually, because when they call in, it's like when you call for an emergency, they will tell you everywhere in the world, when you're calling from, where is your location? It's important. That's nobody is a magician. If we don't know your location, it'll be difficult for us to send, a support or a response. So when somebody called, no matter how distressed it is, if the person have the energy to call, the minimum they can do is to have the energy to tell us where exactly, because even if you call the commissioner, right, you don't have any information as to this is what this person has said to us. So there is nothing that even the commissioner or anybody is going to use to reference and be able to give you proper feedback.
Okay, sir. Presently now, doctors are on strike.
Okay.
And you have asked us now we should go to every public centers for this. What is the fate of Lagosians on this, sir?
Good afternoon, Mr. Governor. My name is Will Sinamoni with Silverbird Television. During the last briefing, you made mention of close contact with positive cases now having access to vaccination. Many who have tried that have been said that they have not been able to get a particular date for vaccination. Wilson Omoni, Silverbird Television.
Yeah.
Right. So they have been saying that those who are with close contact, as you mentioned in the last briefing, would have access to vaccination. Many who have actually had friends, families in close contact have actually said they've gone and they were not given dates for vaccination because they did not meet the criteria or one thing or the other. What is the state government going to do to help identify members of family or close contacts at work so that they can be vaccinated? Second question, also to just quickly go through this. The case of the absconder from the isolation center, I don't know if you are aware, there was recently a case that was mentioned of someone who absconded from isolation center. If you have been briefed, you can tell us anything about that particular case at the moment. And finally, who are the persons of interest coming into Lagos? How do we separate them? Are they coming from all over the world or just create countries on the red zone? Thank you, sir.
Thank you very much.
Okay, thank you. So I can just answer this, and if there are questions thereafter, we can come back. So Adedoja, issues around loss of confidence, people that were vaccinated, then the first time also. So this is not peculiar to our own environment alone. Indeed, in other clans as well, people have also noticed that. And so the prognosis, what we hear is that the vaccine is supposed to reduce extensively, the effects of the virus, getting you to a morbidity state, meaning that taking your life. It will increase your chances extensively. That's why some of those vaccines have 90%, 95%, some different level of, it will reduce the likelihood of you dying out of, the virus in the event that you contact it. That's what they told us, right? So, but they haven't said that there will not be one-off case or two-off case. It's very unfortunate, right? But that in itself cannot be a reason for us not to want to be vaccinated. In everything, there will still be a 0 point something percent, that will be off the track. And that's the kind of thing that we've noticed, right? So and it's everywhere in the world. It's everywhere, even everywhere that these vaccines are being, manufactured. They're just getting better. I mean, we've heard about a possible third inoculation in some other countries, for example, after 8 months or 10 months. So there's a lot of recertification that is going on. That it's still a learning process for all of us. But we've seen, especially, and the data is there to prove that in countries where they've done extensive vaccination, the amount of positivity has gone down significantly. So that's why we believe that it's working, right? And it's better for all of us. If we have the opportunity to be vaccinated, please let's take that opportunity and let's get vaccinated. And so the advocacy it's all of us. It's all of us, and we're not stopping. We're not backing down. We'll continue to make sure that we print handbills. We'll continue to make sure that everywhere you go to, we'll have the flyers. The Lagos State Safety Commission are still going around to ensure that at events, that the protocols of COVID-19 are in place. And all of us, like I said, we're all on this together. Gentlemen of the press also still have that responsibility to the general public to ensure that they create adequate space to talk about it and be able to get our people to know that indeed it's still available. The vaccine is still around us, and we need to do everything to be able to, and we cannot but encourage our people, to ensure that once you have the opportunity to be vaccinated, please turn up and get vaccinated. Please, let's do it for ourselves and for our loved ones. It's important. The new variants, the characteristics of the new variant. Well, I think it's all the same thing, right? Commissioner for Health is there. It's still the same symptoms that it will manifest. It's just that in terms of the potency, in terms of the level of infection, it's stronger, right? So that's really what we've been told, that it's stronger, right? And in terms of the ability to be able to infect others, it's stronger, than the and there's been various variants. There'll be various. I mean, the variants now in the last count is over like 15 or 20 different variants. But some have been more prominent than the others. Some have been stronger than others, and that's why the Delta variant appears to have been a lot stronger, than other variants. But we have, like I said, we have the sequencing machine now that we can use to further process, what variant, are we dealing with, at every point in time. And we believe that it's still the Delta variant that is even more prevalent, around us here. Okay, so I think you asked a question around people having a card, to be vaccinated at the first time, and they didn't get the opportunity. Well, I think it's a shame, because what now happened at that time was that some people got the first dose, but they couldn't get the second dose, because it will get to a stage where we needed to ensure that at least we get a lot more people to get the first vaccination. It also has a shelf life, so we also didn't want to get out of the shelf life, and there was still a lot of apathy at that time. So as many as the people that wanted to get vaccinated, even on the first dose, came forward, were giving them. Because you remember that for the second dose, you needed to wait 12 weeks and the rest of it. But if you have people that are dying, let's even still at least get people on the track of giving the first doses, And now, like I said, the second dose for the AstraZeneca, we're expecting the shipment maybe in another 1 week or so. And the people that have gotten the first dose will become the priority to get their second shot and be fully vaccinated even before we go, to others. You said about people going to their homes, and also, I'm not sure that is around. Maybe there will be some one-off cases, but it's not something that we're encouraging. It's not something that the state government, had signed anybody to, and it'll be interesting for us to know who and what caliber of people are doing that. There might be isolated case, of maybe a very bad, severe elderly person that cannot come out, of their bed or something. Maybe an instance like that will have, but it's certainly not what the protocols, that have been set out on, giving out vaccination had been. And I'm sure that they're all keeping to it now. And now we are even better up, we're better prepared for it, because now we know the officers are better trained, they know what is expected of them. And like I said, we've even increased the number of centers, that we have from about 60 or 70 something in the first case now to about 150, places where they can get vaccinated. The lady from Wazobia, it will have been interesting for us to know where exactly it is. And I want to encourage gentlemen of the press. When people come to you like that, for whatever reason, it's important for us to get the proper feedback. We don't know it all, but it's important for us to get the proper feedback. And the only way you can help us is to ensure that you get adequate, proper information so that we can deep down and get to the root, of the matter, right? So at our public, health institutions, we're not collecting, nobody's being paid. And I reiterated it, oxygen is free of charge. We're planning everything to ensure that we increase the number of oxygen that's available. But there's also the private sector facilities. People have the choices, right? So maybe that person thought it was a public health place and he got there and it was a private health place that were certified that they are capable and they are competent to treat COVID-19, not just any and how private institutions. They've also been certified to have the capability to do it. If it's a place the person has gone, that's probably why they cannot give you an address. It's unfortunate. But you asked the question around doctor strike. But doctors, not all doctors are strike. So for emphasis, and I'm looking straight into the camera, the strike, very unfortunate, and we're working right around at the federal level, and I'm sure even at the state, is the resident doctors that are on strike. And for Lagos, for information, the resident doctors are residents at LASUT and a few of our general hospitals where they have residence program that are attached to LASUT. But in all of our other secondary health facilities, there are 29 of them, our doctors are working full-time. In all of our primary health facilities, our doctors are working full-time. So we have enough personnel to attend to patients when they turn up at those hospitals. Okay, so you are asking, around when we mentioned, so 3 weeks ago, we didn't have this positivity rate. So, and we thought that we're going to be getting the vaccination, ASAP at that time, we're going to be getting. So, I mean, what the criteria then will have easily been that once you're infected, you could have also infected people around you, right? And but we started 3 weeks ago when I came on, it was just 4, 5, 7%. Now we're doing 12%, meaning that the positivity ratio is going up, meaning that a lot more community-based infection is also happening. So we needed to track all of that. But like I said, we're just going to be starting the vaccination, on Wednesday, right? The criteria is go on the portal and get registered. They'll give you an appointment, and you will be attended to. So please let's take advantage, of all of that. Question around a lady that was on social media. Yes, I've been briefed. I also watched it. I listened to it very carefully, and I probed further, right? Incidentally, if you have watched, I think the Honorable Commissioner and his team, they responded officially yesterday to the matter. They had a full press briefing to state the government side, on the matter. I don't know how detailed, their responses, but what I remember, and all of it is very unfortunate. The lady, as difficult as the case sound, had not given government the opportunity for them to also say their own side. It was only one person speaking, and it was only one side of the story that you're hearing. The commissioner is here. I don't think want to take so much of your time, but at the end of it, I read the report. It's a lot of the things she had adduced were not correct. In fact, what had happened is that it was when she did not obey the simple instruction. You had paid for your isolation from your red zone. You had paid for your isolation from your red zone. You are coming from South Africa, right? You had paid for the isolation. When you got to Lagos, why did you travel to Ibadan? The isolation you are meant to go and observe is here in Lagos. Why did you have to travel to Ibadan? It was after she had traveled to Ibadan, she now came back to Lagos to say she had done her test in Ibadan, right? And she wants to come and collect her passport. You absconded. And so for you to get your passport, you now need to still do that isolation. And I think those are the details. I don't have the full, he said what, I said what, but like I said, the commissioner is there, but he did a comprehensive, response, which we can still, put out there, to the general public. I think that the final question was, who are the persons of interest? And the red zones, it's from PTF, the red countries are still the 4, countries that has been identified, we believe that indeed we should go further and identify some amber countries as well. Amber meaning that they might not go on mandatory, isolation, but they need to be able to do maybe day 2 or day 7 tests as been done in some other parts of the world, so that we can indeed have a tracking mechanism early enough, enough for that. But for now, it's still the red zone countries that people need to be careful of. But generally, we just need to have that ability to be self-conscious of anybody that has that we suspect, and just be able to keep with the non-pharmaceutical protocols. So what I'm also being told, the information I've got to, that a lot of the countries, I think, it's regarding your question. A lot of the countries that have been vaccinated, right, they've seen significant drop in the death rates. The whole idea, and is what I said, the whole idea about the vaccination, it reduces, the possibility of you getting into fatality, right? And you can go and check, it has significantly, reduced. So it's working, and yes, you might be infected, you will go through the thing, but you will come out of it, after the infection. It will not take you, and the kind of things that are saying that people die, it won't be part of the thing. So any other question? Thank you very much. Thank you very much. Thank you.